cardiovascular safety of nonsteroidal anti-inflammatory agents, NSAIDs, has been intensely controversial since the withdrawal of Vioxx more than a decade ago. There was a hypothesis that selective COX-2 inhibitors would have worse cardiovascular outcomes than the conventional NSAIDs. We recently completed a very long-term clinical trial known as Precision that studied the last remaining COX-2 inhibitor, celecoxib, versus two non-selective agents, ibuprofen and naproxen. The results, in fact, surprised everybody, including us. The agent that was believed to be the riskiest, celecoxib, actually turned out, if anything, to be a little bit better. It was non-inferior to ibuprofen and naproxen with respect to cardiovascular outcomes, and it showed evidence for superiority on renal outcomes, on blood pressure, and particularly on gastrointestinal outcomes. The hypothesis, sometimes known as the Fitzgerald hypothesis, that COX-2 inhibitors would be bad for cardiovascular outcomes, turned out to not be true. There was something about Vioxx that was different. The Precision trial was recently presented at a two-day FDA advisory panel meeting. And the FDA reviewed all of the data and the panel concluded, overwhelmingly voting that, in fact, the Precision trial, the 24,000 patient long-term Precision trial, had in fact demonstrated non-inferiority for celecoxib. But there's more to talk about here. One of the major concerns about the FDA was evidence from in vitro studies suggesting that ibuprofen and naproxen would interfere with the cardiovascular benefits of aspirin. This again is an area where the surrogate endpoint, platelet function testing, suggested there was an interaction. We had the opportunity in the Precision trial to actually look at this. And we have done that analysis, published it just a month or two ago in the Journal of the American College of Cardiology. And what it shows was, again, very surprising. The theoretical interaction between ibuprofen, naproxen, and aspirin was not seen in the clinical trial. In fact, if anything, the data trended in the opposite direction. There was simply not clinical evidence that taking either ibuprofen or naproxen negates the cardiovascular benefits of aspirin. This is another really great example of how surrogate endpoints, biochemical endpoints, don't predict what actually happens in the real world. And so we really don't see compelling evidence that one should be excessively concerned about the use of ibuprofen or naproxen in patients taking aspirin. We do see, however, that celecoxib is as safe as the other NSAIDs for patients at high risk for heart disease or who already have heart disease, and that it has real benefits in not raising blood pressure as the other NSAIDs do, and having much better renal and gastrointestinal outcomes. So what we expected, we didn't find. What we found, we hope is useful to you in making decisions about how to treat these patients.